Whether you're looking for answers to specific life questions or seeking to become the best version of you possible, welcome to the Mental Breakdown and Psychreg podcast, where we offer insight, information, and strategies based upon research and years of practice as clinical psychologists. So sit back, have a listen, and get connected with our hosts, Dr. Berney Wilkinson and Dr. Richard Marshall. Welcome back. Richard, today we're going to continue our conversation about substance abuse, recognizing September as National Recovery Month.
Right.
And today we're going to talk about, we're going to work to define addiction today. We're going to talk about what addiction is, what substance abuse is, and we have a variety of articles and websites in the show notes that folks can go to and check out to get more information, but we're going to kind of hit the big stuff here on the podcast today.
And we strongly urge our viewers to go to those websites because the whole field of addiction is rapidly changing.
Yeah.
What we used to think it was is rapidly changing.
Yeah.
And people who are concerned about this topic, either for yourself or for others, family members or loved ones, you may want to bring yourself up to date.
Right.
Because it is a rapidly changing field.
Yeah. Mm-hmm. Yeah, so we're gonna talk about the way that I think we're going to talk about it is we're going to talk about what it is,
right.
And then we're going to. But I want to frame it in a maybe a different way than most people have thought about it before, because we always think about addiction. We combine addiction and the substance use and the substance abuse, and we combine it all into this one piece. But I want to kind of work to split it apart a little bit today. Does that make sense?
No.
Fantastic. Well, great.
No.
Because here's what I mean. When we think about addiction and substance abuse, we think about, okay, we'll just use alcoholism. All right, so alcoholism. And we think, okay, and then we have the whole debate of, okay, is alcohol abuse a mental health disorder? Or is it just an addiction? Or is it a physical health disorder? What is it?
Or is it a moral failing?
Or is it a moral failing?
Okay,
right.
so because we have these different perspectives.
Right.
Okay, it could be when you say you differentiate health and addiction.
Right.
There's mental illness, health, addiction, and moral failing.
Right.
Why do you differentiate? How do you differentiate health and addiction?
I differentiate them because there are those of us, there are those who are driven to overindulge in something. And that may be rooted in a mental health concern, which is one piece. Right. It may be rooted in a biological need for something. That's another piece. But then addiction becomes a physiological issue. And that's what I really want to make sure that we spend some time.
What category do you put that? Is that the addiction?
That's the addiction.
Okay, that's the hook, the chemical hook.
Right.
Okay, so when you're using the term addiction, that's your brain gets hijacked.
Right.
Okay.
Right.
That's sort of, okay.
Yeah, I think that addiction, and that's where we start to get into blurry lines, and I think that we have to keep them things separated. Because they are two different things.
That's right.
Very different things.
Because it's even confusing when we pick up DSM-5.
Right.
To make a diagnosis, how do you sort all of this out?
Right.
And it's not clearly sorted out yet.
Right.
Okay.
Right. So if we can kind of explore it just a little bit. When a person starts to use a substance, my perspective, I think our perspective is that they tend to use that, and they tend to do so because of some mental health or some physical need. We refer to it as self-medicate.
Okay, so one reason is people begin to self-medicate. They feel some absence of something or a longing for something, and so they want to treat themselves.
Right.
They find that alcohol or
some substance,
some substance or some behavior. Activity. Mm-hmm. It could be running, or it could be drinking.
Right.
Some activity makes them feel better and addresses that felt need.
Right.
Okay.
And we're going to spend more time talking about that in tomorrow's podcast.
Right.
Okay. Mm-hmm. But once they start using a substance and they find that substance helps remedy that problem, it is after that the addiction begins. or that is when the person is at risk for the addiction.
Now, would you say that they first become dependent on the substance?
I think
like running. I depend on running to make me feel better. I depend on arranging everything neatly in my house to feel better.
Right. Yeah, I think that is where the transition begins.
Right.
From a, whether we want to call it a coping strategy, maladaptive perhaps coping strategy, into more of an addictive behavior when you need it.
We find something that satisfies us.
Right. Okay. Right.
We're not yet addicted to it.
Right.
But we find something that satisfies this felt need.
Right.
Okay.
The addiction comes from my perspective, our perspective, I think.
Right.
The addiction comes when there is a physiological need for it.
And that's where you get into the biology of addiction.
Right.
Right. Because there is some point where how do we say this clearly? Where your brain needs a larger amount. Should we talk about dopamine here?
Yeah, we'll talk about dopamine a little bit and some of the other neurotransmitters, but we can use any of them.
Because what actually happens in your brain is that this is the brain's reward system. I mean, that's what we're talking about. I want to feel better. It's the brain's reward system. And the brain's reward system is dominated by dopamine. There are other chemicals, but it's dominated by dopamine. I think it's fair to say, correct me, a person becomes addicted when they get accustomed to a higher amount of dopamine. Right? All of us need it. All of us use dopamine to feel good. But you become an addict when a particular substance or activity increases dopamine and the brain gets accustomed to the higher level of dopamine. And only that activity or that substance will satisfy you.
Yeah.
Is that fair?
I think that is absolutely a part of it. I'll use a slightly different chemical or neurotransmitter as the example that I typically offer students. So our brain uses a neurotransmitter called GABA as a way to decrease neurotransmitter activity or neurological activity.
GABA.
Yeah, GABA is a neurotransmitter that it's the primary inhibitory neurotransmitter. So it decreases the likelihood that a neuron is going to fire. Okay.
It decreases
the likelihood
that a neuron is going to be activated in some
right.
way.
Okay. So we use GABA enhancing medications for seizure disorders, for example, because seizure disorders is an overactivity of neurons, and so we give GABA agonists gabapentin and things to decrease those neurons from firing. Okay. Another substance that does that is alcohol. Alcohol behaves like GABA. It potentiates or it is an agonist for GABA in the brain. So, if a person is over anxious, if a person is a nervous type of person, overwhelmed, that person's neurons, if we want to think about it in this very basic way, that person's neurons are overfiring. And so one thing that person may use to address that overfiring is alcohol. Another thing that they could use to address it would be Xanax or Ativan, a prescription medication that does almost exactly the same thing. So they use alcohol to mediate that overactivity of neurons.
Slow down the brain.
Right. Now,
that's right, because when you use alcohol, it inhibits your brain from doing what it's supposed to do, and you lose frontal lobe functioning. We explain that to our students. Alcohol inhibits okay. So that's another good way of putting it, is you want to reduce brain activity.
Right.
Okay.
So then what happens over time, and we all know this, is that if your brain is making this much GABA and it's not enough, you supplement it with alcohol, and so now you're making this much. Now, for as smart as our brain is not wise enough to figure out where all this GABA is coming from.
It doesn't care.
It doesn't care. It just says it's there. But what it will say is, you know what? We've got a lot of GABA in here, so we need to cut back on the production of GABA. So it will, instead of making this much GABA, instead of making this amount of GABA, it's going to cut it down and make less GABA.
That's right. There's another simple analogy would be if you're low in iron, you take iron supplements.
Right.
Okay. But if you're taking supplements, your body produces less.
Right.
Right.
Right. So now your body's making less GABA, and so that's why we get into something what you're referring to as tolerance, which is where we need to drink more to get the same effect.
Because your brain is producing less, so now you have to take more of the supplement.
Right.
Okay.
To result in the same amount.
To get to that level.
Right.
Optimal level.
The more that you drink and the longer that you drink, the less GABA your brain is going to make, and the more you're going to have to drink to get the same effect. Okay? Again, we call this tolerance. That's one of the key signs of addiction. That's the addiction. That's the part that is the physiological need. Because once that starts to happen, the body needs the alcohol. Because what happens is if that person decides, okay, you know what, I'm done, I'm going to go dry, I'm not going to drink any more cold turkey, that person very literally could die from the withdrawal effects. Withdrawal are the physiological consequences of decreasing, abruptly discontinuing a substance or medication.
And that's what we see. It's so dramatically when we watch TV programs of somebody going through detox or somebody going what's called cold turkey.
Right.
What's happening in your brain is that your brain now has started to, first of all, it has to get used to less because you stopped the supplements. So it has to get accustomed to that, but it also has to begin the production of its own GABA, and this takes some time.
Right.
And that's the danger. That's the dangerous part. Is it you're now denying your brain of a necessary life-saving ingredient.
Right.
Okay. And that's why people die. Xanax users are particularly prone to this.
Right.
Is that when you stop those kind of drugs too quickly,
right,
you can create a lot of havoc in your brain.
Right. Because if you think about it, that alcohol or the Xanax or whatever it is there to decrease neurotransmitter activity, neuronal activity.
Right.
Well, if you take that away, the neurons are going to fire. So what do you get? You get seizures.
Overactive brains.
And
they're firing almost willy-nilly. They're randomly because
right,
they're just exploding because you don't have enough of the inhibitory substance.
Right.
Right.
And that's how people die from alcohol withdrawal, because they go in, they basically have a seizure, a prolonged uncontrolled seizure that ends up, making it to where they can't breathe, and it affects their heart rate and everything. So that's how that happens. But that is addiction. We've all experienced it. If you are a caffeine drinker and you go without caffeine, you get that characteristic headache and some of that little bit of irritability.
For a couple days, right?
Right.
That's your brain coming back to normal.
Right.
Okay.
And that adjustment takes, as you said, it takes some time.
Days to weeks.
Right. With some things. With some other things, it takes much longer.
Even longer.
One of the sort of tenets with alcohol recovery and general substance abuse recovery is don't make any massive changes for that first year. A year.
Right.
Okay? We're not talking about a couple of weeks. We're not even talking about 28 days, the typical inpatient program.
Yeah.
We're talking about a year, because it's going to take your body, your brain long to recover. Especially, if you've been drinking a long time or using a substance for a very long time. It's going to take you a while to recover. And we're going to talk more about this stuff for Friday's podcast, but when we talk about treatment. But that's the core of addiction. The addiction is that physical need to change the chemistry in the brain. It's rooted in different things. It's maybe caused by different things.
Right.
But the addiction itself is that physical need.
If you think of the spokes of a wheel,
right,
the hub is addiction.
Right.
There are many ways to get there.
Right.
And I think that's the confusing part, is there are many ways to get to addiction. But when we talk about addiction, we're talking about this physiologic, biological process that occurs in your brain. I mean, this is why physicians, when they prescribe anti-epileptic medications or antidepressants, is they'll say to you, you have to come off gradually.
Right.
Because if you reduce them gradually, you avoid these withdrawal effects.
Right.
So even physicians do that, and many people are familiar with that. Well, it's the same thing with illicit drugs, illegal drugs, whether it's alcohol or nicotine or caffeine.
Right.
It doesn't matter what it is. If you suddenly stop using what your brain became accustomed to, you're going to experience some kind of withdrawal.
Right.
And it might last several days. In the case of caffeine, I think it usually lasts about 2 days.
Right.
People a day or two.
Yeah.
Whereas other substances, it could be much longer.
Right.
I mean,
right.
The adjustment period could be much longer.
Absolutely. And so this, with this being the nature of addiction, we have to sort of adjust and shift the way in which we think about it and we talk about it. One of the things we often hear people say is that they have the addictive gene.
Yeah. Right.
Okay.
It's not really a gene.
I don't buy it.
No, it's not really a gene. Because
No.
It's shorthand. I have the addictive gene is shorthand for a much more complicated process.
Right. Because what invariably happens is we say, well, I had this person in my family was an addict. This person in my family abused this. This person in my family abused that. And so we talk about it as an addictive gene. It's not really a gene because there's not a gene that says, hey, you really need alcohol. There's not a gene that says that. There may be a genetic predisposition for a mental health issue that results in an underactivation of GABA or underactivation of dopamine that increases the propensity or the likelihood or the possibility of you abusing a substance to increase those chemicals.
Yeah, in addition to hair color and eye color and shoe size and body type, we also inherit our parents' brain chemistry.
Right.
And our parents' brain chemistry is going to be similar to our brain chemistry. So if they tend to have that characteristics, we tend to have that characteristic.
Right.
But you don't inherit a gene.
Right.
I mean, you don't inherit an addiction.
Right. Yeah, people learn very early in life how to cope with different stressors. And so if you see your father or your mother as being a very stressed and overwhelmed person, and they cope with that stress and feelings of being overwhelmed with alcohol or some other substance, then the likelihood is increased that you will do the same. When you experience feeling stressed and overwhelmed, you're going to see that that's how they coped with it, and so you're going to cope with it the same way. Moreover, because you have their similar genes, you're going to have an increased likelihood of feeling overwhelmed and stressed. Some people manage that stuff very easily, naturally, don't even have to really think about it, and things just don't get to them. Other people, just the slightest hint of discomfort and they're overwhelmed.
Yeah, we tend to manage things the way our parents manage them.
Yeah, so it's just the way that it happens.
One of our friends at the much of this information is contained in this reading, which we're going to be posting.
Right, the American Society of Addiction Medicine.
Right, and they gave a nice little 5 ABCDE shorthand for answering this question of am I addicted? Should I worry about an addiction? So ABCDE. A.
Abstain.
I can't stop.
Right.
Okay.
Right.
When people come in and say, well, marijuana is not addicting.
Mm-hmm.
Yeah. Well, if you can't abstain.
Right. And people dance with that one very nicely.
That's
They'll
a nice way to put it.
I don't want to.
Right. I don't want to.
I mean, I could quit if I wanted to.
Right.
And then, why don't you? Well, I don't want to.
I don't want to.
So, but that inability to abstain is a key part of an addiction.
Right. B.
Behavioral control.
Right.
Right. So anytime you're doing something that impairs your ability to control your behavior, maybe an addiction.
Goes with can't stop, can't control my behavior, doing things I shouldn't do.
Right.
Okay. C is the craving.
Yes.
Okay.
Yes.
And
so
that's
hunger
in
and drive
DSM. That's in DSM. Is the craving. And D is diminished recognition of significant problems.
Right.
And we see this all the time.
All the time.
Okay, that is one of the hallmarks of addiction, is that diminished recognition. It's not a problem.
Yeah.
But it's not a problem. It's not a problem that I'm not working. It's not a problem that I work part-time. It's not a problem that I'm not taking care of. It's really not a problem.
It's not a problem that I've had 3 DUIs. That's not a problem.
That's right.
You know? It's those coppers. They just keep getting me.
It's the police. Yeah, it's their fault.
Yeah.
Right. And E is
a dysfunctional emotional response.
Right.
There's your emotions.
Emotions. Right. So it's emotions, behavior, cravings, and abstaining.
Yeah. Yeah. So there's your A, B, C, D, E.
Right. Diminished recognition of significant problems. So all of these are the 5 things that we see with people who do become physiologically addicted to either an activity or to a substance.
Yes. And it does, there does become a time when there's a psychological addiction, like we were talking about the physical addiction to it. There is that potential for the development of a psychological, and I'm going to put addiction in sort of shutter air quotes, and that's where we feel like we need it. Right. We just say, I can't get going unless I do this.
Right.
So
now, at the risk of muddying the waters, we've clarified. I think we've clarified nicely what addiction is, and I think spoke of the wheel is a good metaphor. At the risk of muddying the waters a little bit, people will frequently ask us, well, I drink, but I don't have any of these other impairments.
Right.
Okay. I can go home and drink a 12-pack of beer, but I don't. I take care of my kids. I go to work the next morning. Should I worry about addiction?
Yes. To muddy the waters.
No, because some people will say, if you have more than 2 drinks per day, that you're an addict.
Right.
I don't have any of these impairments.
Right.
Am I an addict?
I think perhaps where the water is getting muddied is the difference between a diagnosis and a risk factor. You know, a diagnosis means that you meet certain criteria. And you're
talking about DSM diagnosis.
Right.
Okay.
Right. So
your official psychiatric diagnosis.
Right. And so, and we talked about this a little bit when we did the podcast on functional alcoholic.
Right.
On the functional alcoholic.
That's
right. If you're functional, if you're doing everything that you need to do, and you're meeting your daily needs, and there's no impairment in any form of functioning, then it's not a disorder.
But it could be an addiction.
All right,
there's where the rubber meets.
Right.
I think that's one of the important characteristics. You don't have a diagnosis.
Right.
A mental health diagnosis, a psychiatric diagnosis, but you may still be an addict.
Right. Right. And
so these are not diagnostic criteria.
Correct.
And that's the difference. And that's where people start to have trouble, is they're thinking, well, I'm not an alcoholic because I'm not impaired. Addiction doesn't necessarily mean you have these impairments. Okay.
Yeah. So it's it muddies it a bit, but we have to remember that we're talking about 2 different things. We're talking about the difference between a diagnosable disorder and an addiction, or in the very least, risk factors for an addiction.
Now, there's one other point that I'd like to make before we leave here. I think this is probably the right time to mention it. Some people come to us and they say, well, I'm going to quit drinking for 30 days just to make sure that I can.
Yeah.
No, honey. No. That shows nothing.
Yeah. No.
Okay. Because typically people who say that are binge drinkers. These are people who may not drink every day, but when they drink to excess. Right. They drink to intoxication or blacking out. If you're a binge drinker, you can easily quit for 30 days.
Right.
But the moment you start, you're going to go to blackout. You're going to go to intoxication quickly again. Yeah. That's the pattern of drinking that you do. Yeah. So this thing about, well, I'm going to quit for 2 weeks, or I'm going to quit for 30 days, or I'm going to quit for 2 months, doesn't buy anything.
Yeah.
Don't delude yourself into thinking that buys it. It doesn't buy anything.
Yeah.
Okay.
All right. This podcast went a little bit longer than usual.
A bit longer, but it's a good foundation for what's coming.
Our bad.
We apologize.
We do have more to talk about tomorrow, though, when we talk about sort of the root of mental health, or of substance abuse. I gave it away a little bit.
Well, that's okay.
But it's okay.
It's a little teaser, what do they call those in movies?
Spoiler.
Spoiler. Did it a spoiler.
So, all right, well, we will be back tomorrow.
We'll be back tomorrow with more.
So, all right, until then, stay happy, stay healthy, and forget to be afraid.